I'm here with Dr. Jules Walters, and he's one of our sponsors of Unite. So Dr. Walters, tell us a little bit about what kind of doctor you are and what you specialize in.
Sure. So I'm a board certified plastic surgeon. Been in practice for the last 8 years. My specialty is cosmetic surgery of the face, breast, and body.
Okay, great. And when I first walked into your office, I noticed it's very chic and clean, and it smells good, and it just kind of puts you at ease. You walk in, you hear the music. I definitely feel at ease, and it's a beautiful office that you have here.
Thank you. Yeah, it was a lot of thought process that went into designing the layout and the space, and really that's the same exact feeling that you just talked about is what we want our patients to feel when they come see us.
Yes. So what made you decide to become a doctor, and specifically in this field? Was there a life experience that you had, or did you always know you wanted to be a doctor? What led you to all this?
Yeah. So as far as I can remember, I always just wanted to be a doctor. So I remember just as a small child telling my parents that, that's what I wanted to be. I wanted to be a doctor. I was always amazed. I think even just going to the doctor when I was a little kid, I always looked up to physicians. But there wasn't really one particular instance in my life. It was just kind of almost brainwashed and just a natural kind of feeling that I wanted to kind of help people and, as far as being a surgeon, use my hands and be able to kind of really deliver healthcare for patients. And so as far as I can remember, I wanted to be a doctor.
Well, since you've been practicing medicine, or even since you've been in medical school, what sort of advancements have you seen specifically in your line of work, or anything that's been noteworthy that you've really seen big changes come about? I know medicine is always evolving. What have you noticed?
Sure. So I think as far as plastic surgery, I think 15, 20 years ago, the word plastic surgery, people just think patients are going to look plastic or look fake. And I think the biggest advancements over the last really 10 years and 5 years is, the technology for us to be able to offer natural results for patients and really just restore, just for like, say, a patient who had children and to undergo a mommy makeover, we really can restore pre-pregnancy bodies in a very natural way so it doesn't look plastic or look fake. So.
Right. So you are dealing with a lot of people who, having a plastic surgeon, they're there to make you look and feel better, but you start off with people who maybe aren't feeling so good about themselves, or if they've been through cancer, maybe their body has changed. How do you put people at ease? I mean, certainly when you come into this office, you feel at ease just automatically, but how do you as a doctor, or your, the people that work here at this office, how do you help put patients at ease?
Yeah, so that's something, from the start of our design of our office, and for the first time that a patient really calls us, we really strive on the patient experience. So, all of my staff and, my team, we understand that. We understand that patients are calling about something maybe that they're anxious about or they feel less confident about. And so really it's from the initial phone call is to make patients feel at ease, make sure that they call the right place, and make them know that I have the credentials from that first phone call to help them with the problem that they are looking for a solution. And so it's from that first phone call to the time that they come into our office, and then by the time that they meet me, it's really, first just establishing that rapport and really listening to patients, and then offering advice. And I think from all of that, it's us getting to know each other and, establishing that rapport, and, then showing that I have the ability and the credentials to help them with the problem that they're looking for. And I think it's a combination of all of that. And it's not just me, it's my team too. And I think that really helps kind of patients feel at ease.
Absolutely. So you've been a sponsor of Unite for about 4 years now. Why do you think it's important to have a program like Unite in our community, not only for the women who are surviving and fighting cancer, but for their caregivers and also for the doctors to become involved as well? Why do you think it's important?
Yeah, so, I think we as physicians, we always, focus on the physical healing and, sometimes the emotional healing and the mental healing with dealing with in my field, a breast cancer diagnosis is somewhat lacking. And so, at the end of, say, a patient's reconstruction, the patient can, feel whole or look whole again, but that's really just the physical aspects. And so, my patients who have gone through the program, I really see that just be the finishing touches of their complete healing, so that it's not just a physical healing, but it's kind of healing from that emotional aspect, and seeing the camaraderie and really the smiles on their faces, I think through the program is really enjoyable to see.
Well, I was going to ask you about that. So thanks for answering that already. What's it like to see them up on stage or being a part of the program? I think you touched on that very well.
Yeah, I think it's very rewarding, because when we are first meeting with them as a plastic surgeon, as breast cancer patients and whatnot, it's a challenging time. There's a lot of emotions, there's a lot of fear, a lot of anxiety, a lot of unknowns at that time. And so to see them kind of walk across the stage, it's a total new sense of confidence, and you can really kind of get that feeling that they are, on their way to complete healing. And I think that's just a very rewarding kind of experience and feeling to see as a physician and as their doctor.
So you've been to the Unite events and you've just described it very well. If you could describe it in just one word, Unite as an organization, what word would you use to describe Unite?
I think the final healing process, the final element in healing.
That's great.
What I kind of see.
That's great. I love that. So you're a Louisiana boy, right? So why did you decide to stay in Louisiana and open your practice here? What drew you to this area?
Sure.
What made you want to stay? What do you love about Louisiana?
Yeah, I think it's just, most of my family is still in New Orleans, and, the people of South Louisiana, all of my friends are here. I trained in Houston for plastic surgery, and I was contemplating staying in Houston and then or coming back to New Orleans. And I just think, to just be closer to family and friends, and to be able to bring, all the training that I received in the Texas Medical Center back here to New Orleans, I think was just a lifelong goal of mine, and it worked out great. So. Yeah.
Well, we are so happy to have such a wonderful facility like the Modern here, and we are very grateful that you have been a sponsor for so long, and we're hoping to see you at the October 1st event, Ribbons Rock the Runway. Hopefully we're setting a world record. Perfect. There. So, and we know you've been to several events before, so we're excited to have you back again, and thank you so much for being a sponsor.
Well, thank you for having me. I really enjoyed it.